There are benefits of cardiac rehab for people with heart disease. Wendy Kushel shares more in our Health Watch.
February is American Heart Month. I caught up with one Northeast Wisconsin woman who says paying close attention to the symptoms of an oncoming heart attack and cardiac rehab may have saved her life. Cardiologist Frances Wolf with Aurora BayCare recently worked with patient Lynn Kopolansky of Manitowoc to manage her heart disease. But it was work on both their parts that helped keep her from having a heart attack.
Lynn was, I think, astute enough to realize that the pain was different. The pain that she was having now was actually, by her description, classic for what we call angina, or pain coming from the heart not getting enough blood supply. She then went on to have a stress test, and it showed that indeed the front part of her heart was not getting any blood supply when she exercised. She went on to be catheterized, and the front artery, the anterior descending, had a severe blockage, which was managed with an intracoronary stent.
Lynn says her symptoms started when she was dancing at a party, then again when walking through snow.
I experienced the burning. It was after activity, but then I also noticed it under stress. I thought it was my asthma.
Typical symptoms are chest pain or pressure or tightness, many times extending into the neck or into the arms, associated with shortness of breath. We have learned over the years to be very careful how we ask the question. If you ask people, are you having chest pain? Many times they'll say no, because what they feel is pressure or a tightness. They don't perceive it in their mind as pain. So you have to be very careful how you ask these questions.
Part of Lynn's recovery after getting a stent put in is cardiac rehabilitation. That involves monitoring the person's heart while doing cardio exercises to strengthen the heart and lungs.
Probably a more important part of it, though, is the psychological effect of helping them to understand why they got where they are, understanding what the risk factors are for the development of heart disease, and to provide them reassurance that they're going to be okay into the future, to reinforce the kind of healthy lifestyle that they need to prevent the disease in the future.
And Lynn appreciates the coordinated and specialized care she got close to home.
It wasn't scary to me. The staff was all very knowledgeable and very courteous, and walked you through the whole thing several times. They tell you why they're doing this and what's going to happen.
To get in touch with Aurora BayCare on their cardiovascular care, call 1-866-938-0035, or you can now email them at healthwatch@aurorabaycare.com.